Hi everyone. Let's watch our teeth. Cleaning at the dentist. Today we have two videos: the teeth with large tartar and plaque. Tartar is actually mineralized plaque that cannot be removed with a toothbrush or dental floss. As you may have noticed, for a safe and effective cleaning, you need a professional dentist to remove it from under your gums. Usually, if a patient has problems with tartar, this includes patients who have tartar more than once every 3 months, then we suggest that he enter our dispensary group for our observation. We will conduct periodontal charting and remind the patient to come to the appointment. If we observe gingival prolapse below the level of healthy gums, then it is necessary to take an X-ray and carry out medical procedures. The cleaning itself is done with a special tool, an ultrasonic scaler. Cleaning occurs due to the work of water under ultrasound. We run the tip of the scaler along the edge of the tooth, slightly plunging under the gum. The anatomy of the gums allows you to go deep to a small length. Most often this is necessary for more chronic processes with a large amount of subgingival calculus. If this causes pain for you, then you can carry out the application of anesthesia, which will greatly facilitate the process. After cleaning, the teeth are polished and treated with an antiseptic. For thorough antiseptic treatment. So if you liked watching the process as much as I did, like and subscribe so as not to miss the best health videos.